My name's Helen Roberts, and I'm the Head of International Disease Monitoring and Risk Assessment in the Animal and Plant Health Agency. I provide advice to the DEFRA Imports Trade and the Exotic Disease Control Policy teams in DEFRA. Over the last few months, we've been monitoring the disease situation in Europe, in particular the experience and spread of the blue tongue virus. Disease contingency planning for any exotic disease outbreak starts with preparedness. We use a multifaceted approach involving government, stakeholders, industry, and importantly, livestock keepers and veterinarians. Understanding the risk, knowing what to look for, and who to contact are the first steps in preparedness, and the following presentations have been put together by myself, Dr. Simon Carpenter of the Pirbright Institute, and Dr. Karen Darple of Surrey University, to provide you with some more information. Just as a bit of background, blue tongue is a notifiable viral disease of sheep and other ruminants caused by 26 known serotypes. It's detected in most continents around the globe. Some serotypes, notably blue tongue 8, can also infect and cause clinical disease in cattle, but other ruminants are also potential reservoirs, such as deer and other wildlife. In all cases, the main route of transmission is via biting midges. These are plentiful in the UK, particularly Culicoides obsoletus complex. But blue tongue 8 is unusual in that it can also pass transplacentally. In other words, it can be transmitted from the dam to the calf. In 2006 to 2008, blue tongue 8 caused a major epizootic across northwest Europe, resulting in thousands of animals being infected. Disease control measures focus on the use of vaccination as the most effective measure for any vector-borne disease, and this is certainly true for blue tongue as well. The use of vector control is difficult, it's complex, whether you use insecticides or vector-protected establishments, and it's unlikely to stop the far wider spread that you see. It could only be useful at a local level. Since the major epizootic in 2008, the situation between that year and up to 2015 has improved considerably in northwest Europe. Under EU rules, and in this case it's the Blue Tongue Directive 1266/2007, vaccination with an EU-approved vaccine is required to allow the movement of animals between zones. This legislation was put in place following the blue tongue epizootic to allow trade to still occur. Movement is only allowed within the same type of zone, so for example blue tongue 8 to blue tongue 8 restriction zone, if the animals are not vaccinated, provided that they are still tested and moved safely. But if you're moving out of one of these zones, or you're going from a restriction zone to a free zone, or to another restriction zone of a different serotype, the animals must be vaccinated. Once an outbreak and circulating disease are confirmed, control zones must be put in place, and disease freedom cannot be regained until at least 2 vector seasons have passed without new outbreaks. So that can be up to 3 years after your initial index case. The zones, which are the minimum requirement in the directive, cover up to 150 kilometres around an outbreak. Because this is a vector-borne disease, this is not foot and mouth disease. Our zones are much larger for blue tongue than they are for that disease. A significant level of surveillance would be required by the competent authority as well to show that you've got disease freedom in those zones. But in 2012 the rules changed with a new piece of legislation which now allows vaccination with an EU-approved vaccine to be done out with the restriction zone. And this has improved the situation considerably whenever we have a disease outbreak. So just to remind people of what happened in 2006-2008, here's a series of maps that we've done. The epizootic started in the Netherlands, Belgium area and spread relatively slowly in that first year. But in the second year, it spread very rapidly across northwest Europe. And initially we had some outbreaks in the UK in that southeast region. At the time, we also had a foot and mouth disease outbreak, so we had quite widespread disease control measures in place because of that disease anyway, and we also had heightened awareness of farmers to look for clinical signs. By the end of 2008, much of Northwest Europe was under restriction, but we were also allowed to vaccinate at this stage. And these vaccination was allowed to occur across the zone. So we increased the zones, not necessarily because we had more outbreaks in the UK, but to allow that vaccination to take place. This table shows you the number of outbreaks that occurred between 2006 and 2008 for just some of the EU member states. 2008, many of these outbreaks were detected through retrospective surveillance. However, keep an eye on France there. They had by far the highest number of outbreaks of any of the other EU member states. And this is an important factor in what's happening at the moment. So currently, the situation is that the disease has re-emerged in France. Remembering those numbers of outbreaks that they had in the previous epizootic far exceeded any other EU member state, and also that France has got the highest population of cattle in Europe. In August in 2015, in central France, a single ram showing typical clinical signs for blue tongue, swollen head, respiratory problems, high temperature, was sampled and tested positive for BTV8. A 2-kilometre zone was put around that initial case, and more outbreaks were quickly detected. Restriction zones were then put in place and surveillance began. And one of the reasons for this is that the French were not convinced at this point whether this was actually the index case or if maybe disease was somewhere else across the territory of mainland France. The serotype was confirmed in the National Reference Laboratory and shown to be very closely related to the BTV8 viruses circulating in 2007 to 2008, with about 99% sequence similarity. This also showed it was not a vaccine strain and that it was most unlikely to be a new incursion. The possible reasons for the re-emergence include a low level of circulation in wildlife that could have been happening since 2008, or a low level of circulation of virus in livestock, or possibly the use of semen that was collected during the epizootic and then used for breeding animals later on. Coupled with a reduction in herd immunity, which occurs either through vaccination or natural infection during the epizootic, and because of the high replacement level of cattle, low detection sensitivity with few clinical signs in cattle, all these things means that it's been quite difficult to show that disease was circulating. Vaccination stopped in 2010, although they could still carry on for a bit longer on a voluntary basis. So animals could still be partially protected, and this therefore meant that clinical signs wouldn't be seen. The most likely explanation is that disease has been continually circulating in livestock, and that the level of passive surveillance, because of no clinical signs, limited testing done in France, means that it's just gone unnoticed. What's important is that the immune status of our own animals will be one of the main drivers in how quickly disease would spread in the future months, and what the impact of that infection will be. So in 2015, we were commissioned to carry out a qualitative risk assessment by the policy team in DEFRA. Had a specific question to look at the risk from France of incursion of disease during 2016. To do so, we used modelling, which considered also the size of an outbreak that was likely to happen. We're looking at the most likely pathway for incursion as the movement of midges, and that's because the legal movement of livestock or germplasm will be a negligible risk because of the EU rules around the movement of animals during an outbreak. We also note that not every incursion will lead to an outbreak, not every midge will be infected, not every bite of a susceptible animal will give rise to an infection. The modelling that we used included a Met Office model for wind-assisted movement of midges and spread models for disease between farms. When we're doing a risk assessment, we use the OIE guidelines for an import risk assessment. This is a very structured process. The first step is always hazard identification. In this case, it's easy to do, it's blue tongue 8. Then the next steps are entry, exposure and consequence assessment. As part of the entry assessment, we always consider the different pathways that disease could be brought into the country. We need to understand what those pathways are and also the level of disease in France at this time. We understand that not all outbreaks would be reported. After all, there's no clinical sign, then there won't be any report cases and the passive surveillance system won't work. Disease surveillance that the competent authorities have put in place is designed to look for a prevalence of 5% with 95% certainty, only in cattle. For this, they've taken 60 cattle from 30 farms in each département from mainland France, and remembering that transmission relies on an average daily temperature or at least 12 degrees centigrade, it meant that as they go into winter, you'd expect transmission to drop. For wind-assisted midge movement, this is also temperature and humidity dependent, difficult to assess over land and urban areas. Over the sea, the NAME model that we use from the Met Office has very high accuracy and shows that the midges travel, they're blown by the wind very easily over the sea. By the end of 2015, this is the situation in France, they had put in place a restriction zone covering approximately 45% of the whole land mass. They've reported 149 outbreaks. Multiple regions, 16 in total, were reporting outbreaks. But the majority of these were in cattle and were detected through surveillance. Only 12 were actual clinical reports, and this despite the fact that they had over 490 report cases during this time across the whole of mainland France. But disease was still not at the north coast at this point, still not circulating at high levels. Winter means a drop in temperature and therefore a drop in the activity of the midges as well. Therefore, our risk of incursion at this time was very low. When we're looking at the entry assessment, we're also considering all the different pathways. This is by far the easiest way to do your entry assessment. Consider all the different pathways and the steps in those paths that you can then assign different levels of evidence and data to. And this means that relatively rapidly you can start to negate certain pathways. Post-import testing of live animals, which we carry out under the Vet Checks Directive, means that all of the ruminants coming from a restricted area, as long as they are compliant with the legislation, they can come in quite safely. But if they're coming from other areas where we don't know disease is circulating, we'll pick them up that way. We also consider the vector activity season, because in the winter, when there's very low vector activity, the risk of those entry pathways is a lot lower. This diagram here shows you an example of the Met Office modelling that we can do for midge movement, the wind-assisted movement. It's an atmospheric dispersion model that's been specially adapted to look at the flight and the movement of midges. Temperature and humidity are the most important factors, and when those are suitable, a plume can be displayed on the map. This plume is the probability of where those midges would have gone. So that blue area in the middle is the highest density probability area for midge movement. Once the first outbreak was detected, we asked the Met Office to run the model for us across several different areas, and they showed that at no time period up in the run-up to the disease being detected were there suitable conditions to bring midges all the way up to the UK. When you're looking at the exposure assessment, which is the next step in your risk assessment, it's important to understand your livestock populations. These are two maps that are done by APHA showing the density kernels for the different sheep and cattle populations. These are not absolutely accurate because of the way the census is taken and the way that the data has to be used. However, it gives us a very good idea of where our highest risk areas are. And these density population maps are used in the spread modelling. So what was the result of the risk assessment? There are still several uncertainties here, and this has made the assessment quite difficult to do. For example, if the blue tongue virus overwinters in France and continues to spread, if the weather in the coming summer is very hot in France and the UK, this will mean the midges are more active, which will increase the biting rate. If disease spreads into Belgium and Netherlands, then we need to be looking at other directions of wind blowing midges over. And if vaccination isn't available for either preemptive vaccination in the UK or preventive reactive vaccination in France, taking all these uncertainties into account, we've assessed that there's a 5% likelihood of an incursion happening in May with low uncertainty, a 30 to 50% likelihood by July with medium uncertainty, and 80% likelihood by September with a high level of uncertainty. This uncertainty will reduce as we go into the summer and could mean that these likelihoods go up or down. We need to understand more about the French situation in order to do that. But we should remember that in 2007 to 2008, during that large episodic, disease re-emerged following the winter in affected countries such as Germany, Netherlands, Belgium, France, in approximately July. So we would expect to see the same thing happening this time. And the final step is the consequence assessment. And for this, we're looking at the impact of disease. We've used some economic modelling to look at the impact of infection, but also the impact of your disease control measures. Now, the Blue Tongue Directive is there to allow trade to continue once you have an outbreak by putting in these large restriction zones and allowing you to vaccinate. The spread models that we used suggested that the extent of the outbreak will depend on the place where the incursion takes place and the time of the year. So, for example, if it takes place in the southwest of the UK, where there's a much higher density of cattle, and in May, then the disease will spread further and faster over that summer than if disease is brought in on the south or southeast coast in September. This spread can be reduced further by preemptive vaccination, movement controls, and reactive vaccination. Economically, the main impact is on dairy cattle, where the milk drop can be significant across the herd and across time. Meat is safe to eat, so all animals can still move to slaughter for the food chain, providing they are healthy at the time of the move. Adult breeding sheep, however, will experience the most clinical impact. Therefore, the recommendation to vaccinate should be an economic decision on the part of the livestock owner, and we're asking livestock owners to discuss this decision with their private veterinarians. Now, in France at the moment, they're undertaking winter surveillance. This is for 3 objectives. They're looking for the geographic distribution of disease over the free zone and restricted zone. They've used it to demonstrate seasonally free zones with vector inactivity and absence of virus circulation in cattle, and that was to allow the movement of animals without vaccination under bilateral agreements with certain other EU member states. The UK was not one of those. And thirdly, to estimate the prevalence in cattle, including the level of immunity in animals of a different age, and to identify regions of circulation in 2015 so they can estimate the intensity of infection. And this will tell us how much disease is likely to spread in the coming months. This large epidemiological investigation is still underway. Full results are not known yet. However, there have been more cases reported in the last few months, and restriction zones have increased. Vaccination in France is being targeted to animals in pedigree breeding programs, animals destined for trade, and animals moving out of the restriction to the free zone. There's not enough vaccination to cover all the livestock in France. Therefore, we know that disease is likely to spread in the coming months. This is a map of the current situation, but I would say it does change every single week. France continues to report a handful of cases. Those restriction zones have increased in size, mainly to the south and the east. So far, not so much towards the north. What we'll continue to do is to report on the outbreak situation in France and look at those zones. And as they approach the coastal areas of France, we'll start some of our atmospheric modelling and start doing more risk assessment to see whether we think disease will turn up. So finally, just to say, what should you do? Remember, this is a notifiable disease. If you suspect infection in your animals, you must report this to your local animal health office. Contact the DEFRA Rural Services helpline number on 03000 200 301. More information is available on the DEFRA website at gov.uk. Thank you.